brief description. Okay. So yesterday we follow some of the basics. I'll go through it again. We started with what is US healthcare system. I believe Pritesh has told me that you are already experienced into AR, right? Ankit?
Yeah, yeah.
Yeah. So you must be aware about what is US healthcare system, right?
Yes, yes.
Okay, so tell me what are the three major payers, three major key pieces of US healthcare system?
Patient, payer, and provider.
Okay. So that is what we discussed yesterday, patient, payer, and providers. After that, we moved to Medicare. What is Medicare? The eligibility is, of course, 65 plus, specific disabilities, or the end stage renal disease, right?
Right.
And there are four parts: part A, B, C, D. Of course, in India, most of the medical billing companies, we are handling just part B. That is where all the physicians, billing, practice, solo practitioner, family practitioner, and dental services, all these falls in. Part C is the private plus government plan for the Medicare, which you will also see, there would be another name for it is MAP, Medicare Advantage Plan. And the Part D is the drug coverage for all the pharmacy related plans. Ankit, you are going there?
Yeah, Ankit, carry on.
Yeah. So next we move to Medicaid. Medicaid, everybody know, is a low for the poor income peoples. It is the insurance for the persons who has low income in United States. So it varies from state to state. So like Medicare is a central government insurance. Medicare is state by state. So like in Illinois, it's Illinois Medicaid. In California, it becomes Medi-Cal. In Hawaii, it's become HFS. Every state has its different Medicaid policies and different Medicaid criteria. But yes, the eligibility is same, that you have to be a low income family. So you get automatically you get some Medicaid. Okay, tell me, what is the worldwide rule for Medicaid? Like there is one basic rule that runs over every companies, every patients in Medicaid. So what is that? Are you guys aware of, both of you? Any of the idea?
Worldwide
I
rule.
I
Ankit,
think
are
it's the
you?
poverty level, right?
No, no. So that is the rule eligibility. But
Okay.
there is one rule that, see, you cannot ever bill a Medicaid patient. Okay. So this is one of the rule that is all over across the Medicaid states. If you cannot bill a patient if that is a Medicaid patient. Let's suppose there is $100 claim. Okay, and insurance said that okay, we are not going to pay. You tried with sending medical records or anything, but still they are not paying. Still you cannot bill a patient. So always remember, Medicaid को कभी भी bill नहीं करते. There are no patients that can be billed out. If the patient has a Medicaid insurance, you cannot bill to patient.
Okay.
Okay. Third, we went to Tricare and Veterans Affairs, which is the
Sorry to interrupt, Ankit. So in Medicaid, we always need to bill Medicaid only, na? We cannot bill to patient, na?
no, no. See, initially you will also always bill insurance. Okay.
Okay.
So let's suppose patient has Medicare and Medicaid both. So primary is Medicare,
Hmm.
secondary is Medicaid.
Hmm.
So what once primary process, let's suppose Medicare has processed the claim. Out of $100, they paid $50.
Hmm.
Now the claim has to go to Medicaid.
Hmm.
Medicaid say that okay, we will not pay. Then you that $50 you cannot bill to patient.
Then it will be exempt.
That will be exempt write off. That will be
Right over.
write off.
Okay. Right over.
Or
Okay.
yes, okay. You can never bill a Medicaid patient.
Then what is the use?
What is?
Sometime they pay and sometime they don't pay, right?
Yeah, yeah.
For
So
medical.
if
Okay.
they are paying, then it's fine. But if they are
Okay.
not paying,
Okay.
you cannot bill to patient. Like
Okay.
even any scenarios, even if they leave the, let's suppose Medicaid pay out of 50, they paid $30
Okay.
and $20 was left out as
Okay.
co-insurance or co-pay something.
Okay.
Still, you cannot bill out the patient.
Okay.
Medicaid always has zero copay. Always remember, Medicaid has no copays. Okay, next we moved to Tricare and Veterans Affair, which is of course for the military peoples. So as the name suggests, veterans. So any government programs or insurances which are covering the military peoples in United States or their family, they are Tricare, Veteran Affairs. One more insurance is there, that is Champ VA. Okay, all these three are for
Yeah.
military op.
Military.
And last is the commercial insurances, which is UHC, BCBS, Aetna, Cigna. So they have multiple plans and very vast network is there.
Yeah.
So Ankit, are you getting it?
Yeah, Ankit, yeah.
Yes. Anywhere you have any doubts, any issues, just ask it. Okay.
Okay, sure,
And
no.
Pritesh told me that okay, you are as because you are from Andhra, so English would be more comfortable. That's the reason I'm doing. But yes, Aves is also there. So I would say in English and then translate to Hindi also. Okay.
No,
Uh-huh.
no
Yeah.
problem, no problem.
No, fine.
Okay. Next, we move to US healthcare challenges. So, what are the challenges in US healthcare? So, very first was rising healthcare cost and insurance premiums. So, recently, what happened, if you must have, Donald Trump has passed the big billion bill, which has increased all the insurance premiums cost. Even he has increased the Medicaid premium. So, what has happened now? People have to pay more yearly. The premiums has to be more. Let's suppose earlier it was $100 a month. Now it has become $200 a month. So that is one of the challenge. Okay, just to translate it, what happened is कि पहले जहाँ लोग कम पैसा देते थे कि कम कॉस्ट था, इंश्योरेंस मिल जाती थी सस्ते में, अब प्रीमियम्स बढ़ गए हैं, ज्यादा पैसा देना पड़ रहा है. ठीक है. नेक्स्ट इज एडमिनिस्ट्रेटिव कॉम्प्लेक्सिटी ड्यू टू थाउजेंड्स ऑफ पेयर्स. नो सी यूनाइटेड स्टेट्स हैव मल्टीपल पेयर्स. UHC, Cigna, BCBS, Geha. You will see multiple insurances while you are working. So to handle this is a very complex process, and there is just one organization that handle it, that is CMS, right? Center for Medicaid and Medicaid Services. Okay. So क्या है कि इतनी सारे इंश्योरेंसेज हैं तो संभालना बहुत मुश्किल होता है. Next is high rate of denials due to verification errors or missing authorizations. Now see, everybody knows that the role of authorization. Who wants to join the call? Victor. Okay. Hi Victor, how are you? Mute pe ho. Okay. So everybody knows that eligibility and authorizations are the gatekeepers. Now see, when you guys are into eligibility and authorization process, you have a very crucial responsibility. Like you are the gatekeepers. If you have done the work wrong, then think like all the team has done the work wrong. Right? As because if you would say that okay, patient is not eligible, then of course the doctor would not see the patient. If you would say that okay, $20 is the copay, but in real $40 was the copay, then doctor will only collect $20. So you are the gatekeepers, like very first thing where you are verifying the patient. So this is a very major process and very crucial process, and errors are very much into eligibility and authorizations. So that is why people think that okay, eligibility is very easy, we'll just have to see copay, co-insurance, deductible and out of pocket, and companies also hire them. But the issue is when you don't have the basic knowledge that okay, how the copay, co-insurance varies by plan to plan, then you would also always make a error. And of course then team lead or any manager would say you that okay, what have you done? The doctor, and this is the process where doctors directly respond back. As you can see, the patient is in the office. As soon as you say that okay, $20 have to be collected, and if the patient office knows that okay, last time we collected $40, now we are collecting $20, so what is the issue? So they respond very fast on this. Okay. So translating in Hindi, ये मतलब सबसे इम्पोर्टेंट प्रोसेस आप ऐसा समझिए मेडिकल बिलिंग का है. आप एक तरीके से अगर आपने गलत कर दिया तो पीछे वाले सब गलत कर बैठेंगे. ठीक है, जब एआर वाले भी अगर ये देखेंगे कि अच्छा $20 ही कोपे था क्योंकि एलिजिबिलिटी वाले ने $20 लिखा है, तो वो भी यही सोचेगा कि $20 है। तो इसीलिए बहुत इंपॉर्टेंट प्रोसेस है, और इसमें ना डॉक्टर फॉलोअप पे बहुत फास्ट रहता है, क्योंकि डॉक्टर को पैसा पेशेंट से वहीं पे मिल रहा है। बाकी तो देखो वो कुछ भी नहीं देके जाता, बाकी वो इंश्योरेंस के भरोसे है, बट कोपे तो उसको चाहिए ना।
Right.
Okay, next we move to focus on value-based care and compliance with HIPAA standards. Now, see, maintaining HIPAA across the healthcare system is also a very big challenge, as because there's a very vast network. Okay, बहुत बड़ा network है. So maintaining HIPAA, that okay, patient data is not breached out. And Ankit, you have been an AR experience. Tell me, when was HIPAA incorporated?
19,
1996.
hmm,
And what is the major thing that it protects?
ये पेशेंट का हेल्थ इंफॉर्मेशन PHI.
Yes. Ankit, you're there?
Yeah, bro. Actually, I am in office actually, so that's why
Okay, okay.
I cannot talk more actually.
Okay, okay, no issues, no issue. Okay. Next, we move to RCM. What is RCM? We discussed how the flow chart works. Initially, the patient call and register the appointment or schedule the appointment. Next is the eligibility and verification. Of course, when the patient reaches the office, insurance ID card is collected out and eligibility and verification is done. Third is the prior authorization. Now, if the service that patient has to take is a major service or a major surgery, then of course you need to take a permission from insurance that okay, whether it is covered or not, and that is where prior authorization has to be taken. Next was patient visit and counter documentation. Now the charge entry team, when they all take all the information, there is an intake form. Yesterday I told you guys that okay, there is an intake form in which all the demographic information of patient is entered:
Hmm.
name, date, address, city, emergency phone number, everything is there. After that, what happens, the coder sits, they transcribe the disease into the coding set of codes, and after that the charge entry team submit the claim by entering into the, which form was there, which form yesterday we discussed.
CMS 1500
Good.
for physician, for physician bill.
Yes.
And UB0 for hospital bill.
Nice. Next is the claim submission via clearinghouse. So what we do is after that the claim is submitted, it goes through the clearinghouse, and after that if the claim is paid, the payment team post. If it is not paid, then of course the AR team follow up and ask for the denial. Okay. Now today we will start with the role of eligibility and verification team. Now see, the eligibility and verification team acts as the first quality gatekeeper in the RCM process. Now, as I've already told, so this is something which is the very crucial part in entire RCM. You guys are like, if you guys are doing wrong, then each of the process system will get wrong. So the primary objective is to ensure that patient insurance is valid and active before the date of service, preventing rejections and denial downstream. So see, whenever you will do an eligibility process, whenever you are in eligibility process, whenever you will be assigned by a patient, so very first thing that you will see is any of the manager, any of the team lead that will ask you is whether patient is active or not on the date of service. So you have to check and mention Y or N. Then it comes the copay, which is the appointment fee. Then it is the co-insurance, then deductibles, and then out of pocket. So you guys have to make sure that okay, whomsoever patients you are checking, they are active on date of service. You are not missing any crucial part, so that doctor loss is not happening. So देखिए, now in हिंदी what happen, यहाँ पे क्या होता है कि देखिए,
ओके, फुकट, मतलब आपका भी टाइम वेस्ट होगा and इनका भी टाइम वेस्ट होगा. आप इंग्लिश में बोलती जाएगी, मैं सामने से रोक दूंगा अगर कुछ हिंदी में बोलने.
ठीक है, okay. So now key responsibilities. So see what are the key responsibilities of insurance eligibility process. So first is validate insurance coverage using payer portals, IVR or clearinghouse systems. Now the very first thing is that okay, you have to verify whether the patient is active or not. As because if the patient is not active, then of course the doctor cannot do anything. He will directly say that okay, you are not active on the date of service. We cannot provide the service to you. As because then patient doctor would not get paid. So the very first thing is you have to check whether patient is eligible, active on date of service or not. Okay. Now see, whenever you will check on portal, you will see two dates coming over there. One is the plan begin date, one is the effective date. Okay, so most of the people make error over here that okay, which is the exact date that we have to start. Now
Mhm.
see, you always take the effective date.
Okay.
Okay. The plan begin date is not the date that is the effective date. Plan begin date can be 2018 also.
Okay.
Okay, but you have to take the effective dates of the patient.
Yes.
So this is the very crucial thing whenever you will check in availability, whenever you will check in CGS portal or any of the portal, you will find two dates always coming up as
Okay.
plan effective or effective date.
If I did it.
Plan begin date and effective date. So
Okay.
do not take plan begin date.
Okay.
Always take the effective date. Okay. Now see, you can either check by payer portals which are availability, UHC, Navinet, Geha, multiple insurance portals are there, or through the IVR. Every insurance has their own IVR systems. They have their cards which can be on the back of the ID card. You
Mhm.
can see there is mentioned pre-authorizations, eligibility, provider's office. So from there you can call and you can give the information. Now see
Okay.
what are the key pieces of information that you require to see that whether patient is active or not, whether you are on the call or portal. So very first thing is name and date of birth and member ID. Okay, so these are the basic things that you would need. Even if you would be calling, like suppose I call the insurance agencies, I say that okay, hi, this is Jack calling from provider's office checking on eligibility and insurance. So they'll ask me that okay, NPI, tax ID, provider information, and then
Right.
they'll ask me okay, what is the patient date of birth, what is the member ID, and the date of service you are inquiring for,
Mhm.
and then you will get the eligibility. Same in the portal. Whenever you will see the portal, what happens initially is you will enter the you will select the provider, NPI, tax ID, then you will enter the member ID, date of birth, and the date of service you are inquiring, and once you click submit you get the eligibility.
Yes.
Now once you get the eligibility, the next step is confirm copay, co-insurance, deductible and plan limitations. Now see, when first step is to confirm the copay, the appointment fee. As in India, when you go to a doctor, you have to pay 100 rupees, 200 rupees, the appointment fee. The same appointment fee is called copay in United States. Now,
Okay.
see, most of the people, what they make error is when you will check in the portals, when you will hit submit,
Hmm.
so you will get multiple copays over there. Okay, 20,
Right.
30. Okay, you see multiple copays are over there. But what you have to see is okay, for which specialty you are checking or which is your place of service, 98 health or 11, what is your place of service, that you have to check there. And
90
that
days for
copay will,
office. No?
yes, so that you have to check there, and then only you can enter the correct copay. But most of the people, what they do is they just see that okay, 20 is coming above, then okay, let's put in 20. But reality, they have to see that what is your specialty of the doctor. And according to that, see, I'll show you an example.
मुझे सॉरी टू
One
इंटरप्ट, ये 98 डेज जो भी मैं देख रहा था, मतलब बर्थडे के लिए बैठा था, ये सब क्या 98 मतलब क्या रहता है डॉक्टर, ये कौन सा ये नंबर हम लोग को तो कभी ट्रेनिंग में एसओपी में तो लिखा नहीं है क्या ऑफिस होता है,
तो कौन सा नंबर?
ये जो 98 एंड ये स्पेशलिटीज की
देखो
क्या
ये
रहती है?
ये ना वो रहता है अवेलिटी में सेक्शंस रहते हैं, जैसे जैसे वो हो गया ऑफिस विजिट का है, ठीक है, होम विजिट
हाँ,
का है, तो ऐसे ही 98 रहता है हेल्थ बेनिफिट कवरेज का। सो मोस्टली अगर आप देखोगे तो हेल्थ बेनिफिट कवरेज के थ्रू ही वेरीफाई करते हैं। ठीक है,
अच्छा।
लेट मी शो यू एन एग्जांपल, तब जा यू विल अंडरस्टैंड मोर बेटर। Now, see, this is what an availability portal is. Now, you guys must have gone through this portal, those who are working. So, this is what an availability portal is. Okay, you get authorizations, you get eligibilities and benefit. Now, when you click on eligibility and benefit, just as we were talking, initially what you see is the provider organization.
Yeah.
Okay, next, whomsoever pair you have to select, Aetna, okay, BCBS, whatever you have to select. Next, what you say is here you have to select the provider again.
Mm-hmm.
Okay. Next is the patient ID, date of birth, and these both are only mandatory. Next is which date of service you want to check the eligibility for. And
Yeah.
this is what we are talking about the codes. Now, see,
Mm-hmm.
if you enter 98, this is the professional physician office visit. Now, most of the time, almost 80% of companies, when you are checking eligibility, you always select 98.
Yeah.
Okay. As because we are always working for a professional physician office visit only. Just
Yeah.
in some cases, if you have a different specialty, then only you have to select different thing. Okay.
Got it. Got it.
Let's suppose you are working for a DME doctor. Then you have to select DM.
Okay. Yeah.
Okay, so these are the codes that helps you out. So many people miss this out. You know, the main error what they are making in copays are they do not select the correct code over there. They just enter, everybody will enter just health benefit coverage. This 30 number and submit. Now see 30 can be entered only when you are not getting the eligibility on the specific number. Then of
90
course you can go with this one.
मीन्स 98 पे नहीं मिला तो 30 करना
हाँ.
है.
ठीक है, so this is where most of the people lack out and this is where main copay errors happen as because as soon as you run you get multiple copays over there and then people get confused that okay सर से पूछते हैं कि भाई ऊपर वाला ले लूं कि नीचे वाला ले लूं सर कौन सा ले लूं right so
बल्कि
that
30 के लिए कंसीडर कर सकते हैं क्या अभी ये और बट वी नीड टू कॉल आफ्टर दैट फॉर
no no
बेटर
no
क्लैरिफिकेशन.
we can consider 30 as because see in 30 it gives you all of the details.
ओके.
Okay, it gives you whole plan coverage details. The next is identify in network or out of network status. Now, see, this is very important. Okay, when you are verifying eligibility, so verifying an in network or out of network status is very important for the provider. Now, what is in network? See, let's suppose you buy an insurance. Okay, so whenever in India also you buy an insurance, you must have seen you get a hospital list, right?
Yes.
That you can visit these hospitals, okay, or you can visit to these doctors. So that is what in network.
Yes.
Okay, that okay, these are the hospitals and these are the insurance and doctors that if you will visit to them, we will cover out. But yes, if you are visiting out of the list,
Mm-hmm.
that means you are visiting out of network and then you have to pay from your pocket. So this is very important that while you are doing eligibility, you have to check whether a provider is in network or out of network.
That list,
Now,
that the list of the hospital and provider, they already tie up with each other, na? That's why they make their in network schedule, na?
no, no, not the hospital and provider, the insurance and provider.
Okay, insurance and provider. Okay.
Yes. Okay. Now, see, no one will tell you, but most of the people in I have seen it, like multiple people, what they will say that okay, call and then verify whether provider is in network or not, or whether provider is out of network or not. But I'll tell you a trick. Whenever you get a something like this, let's suppose you have to find a provider for Aetna. Okay, so always type Aetna provider lookup tool.
Okay.
Okay. Now you see, you get a provider search, find a doctor, dentist, or hospital. Is it visible?
Yes.
Now see, when you come here, you can check to the plan, whichever plan your patient is having. Then
Yeah.
you can easily look up the doctor for him. And as soon as you will look up the doctor, you will find here that okay, if the doctor name comes up, he is in network. If the doctor name does not come as, he is out of network. And this can help you from not calling. And most of the people, even I can bet you out in a company,
Mhm.
70% people don't know it. They just pick up the call and start calling to ask insurance that okay, provider is in network or not.
This trick is amazing. I think अब तक जितना ही बढ़िया पे बेटा no one has used this.
Yes, because nobody knows these things. I'm telling you now, I have seen people not using this, and for every insurance it is there. It's just not for Aetna. See, if you will enter BCBS provider search lookup tool, it will give you that also. Now, see, find a doctor, it came. So for every insurance you can find online only whether a doctor is in network or out of network.
But region, we can select the region, right? Yeah.
Yes. Now see, if you enter here, let's suppose I'm entering the client name, which we have is Global Medical Solutions. I select the specialty is DME. Now I'll click on 6620. Now I hit on search. Same as in BCBS, you can find, you just have to select the plan. Let's
Yeah.
suppose you are working for Illinois, you enter 66209.
Okay.
It came in here. Yes, this is correct. After that, you have to enter the prefix of member ID. Let's suppose it's XYZ. Now you entered this. Then you select continue. Then you have options also. You can select search either by doctor name, doctor by specialty, place by name, place by type. So you can see. Now see here it came as no results. That means the provider is out of network.
Oh.
Okay. So you do not have to call all the time for these things. This really save times. Many people, what they do is they just take up the phone and okay, I will call the insurance and I'll
Hmm.
ask them. And even insurance would say you the same thing that you can go whenever you will call insurance. Also, the very first thing that rep says is that okay, you can look up a provider too. Most of
Correct.
the people do not follow it. Okay. Now the next thing is you have to verify the. Now see, in network and out of network, you understood. In net verifying this is very important as because until unless a provider patient does not go to a in network doctor. Let's suppose you stated out that okay, patient is out of network. Now what will happen is as soon as you say that okay, patient is out of network, doctor will do what? He will inform the patient or the patient office where the doctor's office will inform the patient that
Okay.
okay, you are out of network with us. We will give you the service, but what will happen is you have to pay this much as because insurance will not cover.
Yeah.
Okay. Now, there are also cases in which insurance cover, which are if the patient has out of network benefits.
Hmm.
Okay. Now, whenever you will check eligibility, okay, and if the patient is out of network, let's suppose you say to your team lead that okay, patient is out of network. The very first thing he will say, or even in the AR, very first thing that your team lead would respond is, does the patient have out of network benefits or not?
Yes.
Okay. So if the patient has out of network benefits, then it's okay and fine. But if it does not have any out of network benefits, then the doctor would directly say that okay, you have to pay this much, as
Mhm.
because insurance won't pay. So in
Yeah.
network and out of network helps a lot in this way. Next is verify policy effective and termination dates. Of course, this is the same as whether the patient is active or not and when the patient is terminated. Now, many of the Medicaid plans, now see, Medicaid plans roll by monthly enrollment. Now, what happens is many Medicaid plan you will see they are eligible till 1st to 30th of the month only. But when you will see on the 1st of next month, they are eligible again. Why this happens is Medicaid re-enrolls monthly.
You
Okay,
also.
like because see, Medicaid has that low income eligibility, so they re-enroll every month to reduce the premiums.
Okay.
In other insurance, what you will see that okay, patient is effective from January to December, right?
बराबर.
But in Medicaid, you will see that no, it goes by month to month.
अच्छा.
Okay. Now see, whatever the record verification details in the PMS. PMS is another name of software also. So whatever you get the information, you enter into the software. Next is communicate discrepancy to the front desk or billing department. Now, if you find anything not being correct or anything you found is incorrect with the patient end, so you have to inform that to the team leader, or if you have to inform that to the front desk of the office, you can do that. So this is the key responsibilities of eligibility and verification. Now see how the workflow of eligibility happens. We all know the very first thing is patient
हाँ.
schedules an appointment. Okay.
Yeah.
After that, what happens is the front desk collect the insurance information, and then the eligibility team access the insurance portal,
Yeah.
and they verify whether the policy is active, what are the coverage and benefits, and there those things are then documented in the software. And if any of the discrepancies are there, you find any of the errors are there, then you have to notify that. Okay, so this is the simple thing for the eligibility. Now, there are just basic four things that copay, co-insurance, deductible, and out of pocket, which you have to always make sure that you are entering these correct.
Yeah.
As long as you are entering these things current, like no TL, no manager can say you anything else, because these are the main things. Patient is active or not, copay is correct, co-insurance is correct, deductible is correct, and out of pocket. That is what all eligibility is. Now see, there's an example of verification case. Let's suppose there's a patient Sarah Green. She has insurance Cigna. Now everybody knows that Cigna can be seen into the portal. Which is the portal name for Cigna?
I think cover ना.
No, Cigna for HCP.
अच्छा.
So this is the Cigna for HCP. So this is the portal, Cigna for HCP.com. Okay, see it's mentioned welcome to Cigna Healthcare Professionals. Once you click on login, you can check the eligibility over here. So the date of service is August 15, 2015. Now the user logged in. Policy was effective from 1/1/2025 to present.
Okay.
Okay, this means that okay, the very first check we have done is patient is active. Now
Yeah.
copay is 25. Okay. Of course, the specialty is office visit. So office visit copay is 25. Always remember you have to take the office visit copay if you are working for a physician.
Yeah.
Okay, do not until unless you are working for a specific specialty like DME, cardiologist, neurologist, then only you have to take another. But if you're working for a general physician, internal medicines, always you have to take the office visit copay.
Yeah.
Okay. Then there's a deductible 1,000, out of which he has met 400. Now, yesterday I told one of the thing about deductible. Tell me, what did I told? Very crucial thing that okay, remember that
Unless
you
unless and until patient doesn't match his deductible amount, the insurance company not going to pay the amount.
good. So, Ankit, when you are working in AR, you see that okay, the claim is denied as applied to deductible. Okay, every claim is processed as ATD, which called as applied to deductible. What is this applied to deductible? This is what that okay, patient was not paying, so insurance did what? Whatever the claim is coming out, they have directly applied to deductible. ठीक है भाई, तू नहीं दे रहा है तो हम ऐसे ही काट लेते हैं.
अच्छा.
Hmm. Okay. Next is co-insurance, which is mostly 20% all the time. Then, if you are working for a specialist, you have to see whether the specialist visit is covered or not, and referral is required or not. Now this is an example of note. Now notes varies from companies to companies. Now see, what information needs to be collected if you are verifying an eligibility. So very first thing is patient demographics. Okay. So what comes under that is your patient information, the personal information of patient, which is full name, date of birth, address, contact details, gender, insurance or provider name, policy or member ID, or group number for some employers, and subscriber name and relation to patient. Now, most of the things, so subscriber names are not required, but yes, some of the times you will see that family insurance is there, children is also under the same plan. So then you need the subscriber name in relationship to patient. And always ensure that the patient name matches exactly on the insurance card. Okay. As because even if a small mismatch, you won't get the eligibility correct. Now, this is one of the AR scenario. Now, see, CMS 1500 form and its connection to verification. So, yesterday I showed you, right, that in the form till 1 to 23, all the patient information and authorization information is there, right? So, this is how it is. See, in box 1, you will see which insurance is there. Box 1A is the ID number. Box 4 is the patient name, which is the insured name. Box 7 is the insured address or the patient address. Box 11 is the policy number or the group number. And box 1180 is the if the patient has another insurance, then that information also has to be entered. So these boxes are mainly related to eligibility verification in the CMS 1500 form, which is the universal claim form. Now see, how is HIPAA compliance in eligibility verification? See, HIPAA is maintained all over RCM. You cannot disclose any of the information. Even if a patient wants that, okay, he does not want to tell his mother that what has happened, doctor has no right to tell his to mother also, until unless patient gives the consent to do that. Okay. So while working in eligibility, what information you have to maintain is that, okay, do not disclose any patient information to unauthorized persons. Okay, you cannot tell that, okay, this patient has this insurance or this patient has this disease. You cannot disclose these things.
But
Always very yeah.
If suppose some US patient had gone into accident, okay, and he has gone to the coma, but right now the doctor need to call to some of his family, right? So
No, not see what happens is if the patient this is the question. Let's suppose see a patient is going an MRI, okay, and he is unconscious.
yeah.
Now what happens is if the patient is concerned to inform the family, then only the family will involve. Otherwise, the hospital superintendent has the right to do the procedure in the consent.
Yeah.
Okay.
मीन्स जो पेशेंट जो इंश्योरेंस उसने लिया था उसने पहले ही वो फॉर्म साइन कर दिया था कि कंसर्न मेरे को
हाँ,
देना
वो
है
फॉर्म देखो वो जब आता है ना वो
हम्म,
तब उसी वक्त साइन करवा लेते हैं
अच्छा
कंसेंट फॉर्म कि
ओके
हाँ भाई क्योंकि उसके बाद नहीं पता ना होश रहे नहीं रहे ठीक है सो दिस इज व्हाट यू हैव टू डू नेक्स्ट इज ऑलवेज वेरीफाई कॉलर आइडेंटिटी व्हेन कम्युनिकेटिंग विथ इंश्योरेंस हमेशा कॉलर की आइडेंटिटी वेरीफाई करो जब इंश्योरेंस से बात कर रहे हो इवन इंश्योरेंस वाले भी उधर से वेरीफाई करते हैं कि हाँ प्रोवाइडर ऑफिस से ही बात कर रहे हो या नहीं इसीलिए वो लोग ये पूछते हैं प्रोवाइडर टैक्स आईडी बताओ एनपीआई बताओ एड्रेस बताओ ताकि उनको भी श्योर हो जाता है कि हाँ प्रोवाइडर ऑफिस से ही कॉल कर रहा है कहीं और से नहीं कर रहा है ठीक है पोर्टल्स के लिए सिक्योर नेटवर्क एक्सेस करो अब तो ऐसे ही खुल जाता है वरना कई पोर्टल ऐसे हैं जो वीपीएन के बिना खुलते भी नहीं है राइट सो दैट इज द रीजन और नेक्स्ट लास्ट इज डू नॉट स्टोर पेशेंट डेटा आउटसाइड द अप्रूव्ड सिस्टम्स मतलब पेशेंट का कोई भी डेटा इधर उधर स्टोर करके मत रखो वो हिप्पा का कंप्लायंस के अगेंस्ट है अभी एक कंपनी थी डेटा मार्शल हैदराबाद में उसने मेडिकेयर का डेटा ब्रीच कर दिया था चोरी हाँ पेशेंट पूरे पेशेंट्स का डेटा निकाल के सेल आउट कर रहे थे तो वो पूरा उन पे केस हो गया पूरा, अभी बंद भी हो गई वो बहुत
अच्छा,
बहुत ज़्यादा डॉलर्स का फाइन भी पड़ा है उन पे।
कौन सी कंपनी थी विडोन में?
डे डेटा मार्शल।
डेटा मार्शल।
हुँ, ठीक है? चलो, अब मुझे ये बताओ, कुछ सवाल आए हैं। व्हाट हैपेंस इफ एलिजिबिलिटी इज़ नॉट चेक्ड बिफोर द डेट ऑफ सर्विस? बताओ।
और अगर सपोज the plan was inactive, then patient is responsible to pay, right? अगर इसके बगैर दूसरा प्लान रहता तो फिर हम पता कर सकते थे कि उसका कौन सा दूसरा प्लान है
Yes,
currently.
correct. So see what happens if the eligibility is not checked. See, we would not know whether the patient is active or not,
Yes.
whether the provider is in network or not, how much is the copay. Okay, so we are totally blank. Next is how can the eligibility team prevent rejections?
The eligibility is given rejection.
Yes.
Mm, by making sure the plan is active and by making sure eligibility.
No, see, eligibility team plays a vital role in preventing claim rejections because see, our primary goal is to ensure that
The
patient
plan is covered.
insurance.
Main the plan is covered or not for the security.
Yes.
Mm.
No, see, first of all, what we do is we verify the insurance details before the date of service. We
Right.
confirm the plan type,
Mhm.
effective date, active coverage, termination, responsibilities such as copay, co-insurance, deductibles. Now, this helps in preventing the rejection as because when you submit a claim
Mhm.
and if you have entered the incorrect policy ID, the claim gets rejected. It does not goes to insurance.
Yeah.
Now, if we are verifying correctly, we are entering the correct member ID, we are entering the correct details, then only the charge team would able to submit the claim. As
Okay.
because see, charge team does not verify eligibility. They just see that okay, this eligibility person has done it. He might have done it correct. So let's pick it up and submit.
Mhm.
Now, what happens if the member ID? Let's suppose you are doing an eligibility and you put an incorrect member ID.
Right.
Now, what happens is when he will submit the claim would not reach to insurance. It will get rejected by the clearinghouse.
Right.
Now, everybody understands what is a clearinghouse, right?
Yes.
Yes. Clearinghouse is an intermediary between the payer and insurance, provider and insurance. Okay. So when provider submits a claim, it goes to initially goes to clearinghouse. And if the everything is correct, it goes to the insurance.
Insurance.
Okay. And if anything is wrong, it get back to provider again. So those things are called rejections. Now, what steps would you take if portal access is temporarily unavailable? Let's suppose portal is not working. So what would you do?
Call.
Yes. So on call, what piece of information do you need?
Mm. Means left will ask we name, date of birth, and member ID
Okay. And provider information.
and provide information.
Yes. Good. Now see, what we have learned as of now is so as recaps and takeaways, the RCM is the backbone of healthcare finance. Now see this whole structure of United Healthcare system. This is the backbone of healthcare as because see over there everybody has a mandatory insurance. Even though if you want to take or you don't want to take, you have to take the insurance as because they cover each people's over there. And medical billing process is all over United States, even outside the United States in Puerto Rico Islands too, which is Hawaii, Cuba, these things. Then the eligibility team act as the first gatekeepers to clean claims. Now see, you are the most crucial members of the eligible RCM team. If you are doing it incorrect, everybody is doing it incorrect. So you act as a gatekeeper that okay, if I will pass the patient, I will pass the claim, then whole team will pass the claim. Next is proper verification prevents downstream denial. The same thing. See, if you do a proper verification, denial won't happen. If you are doing an incorrect verification, of course, rejections will come out. Clearinghouse will not pass the claim to insurance only. Now, see, every field verified should be accurately recorded and communicated. Now, everything that you have done should be verified, should be recorded, should be noted down in your software or Excel sheet, whatever your team lead and manager has given to you. And then compliance and patient confidentiality. Of course, you cannot disclose any of the data with anyone. It's not, you cannot leak out the data. HIPAA is really serious. Yes, in India, most of the people while working home, they leave their systems open and everything. But when you in United States or when you are doing a work
Mm-hmm.
for a direct client over there,
Okay.
you have to work on their remote system and you cannot even access anything without them. And your
Uh,
system will get automatically logged in 10 seconds.
okay. Here also in IKS, we are working on a remote system for the GI
Okay.
process.
Okay. So now see, I'll send some of the questions that you I'll see how you guys will do into it. Do not do chat GPT or AI, okay? हाँ, वो फिर पता चल जाएगा कि एआई वाला आंसर है। इतना एक्सपीरियंस है मुझे।
Okay.
ठीक है? Next, we'll cover tomorrow is that the learning objectives, what is health insurance. We'll do types of insurances in explain, Medicare, Medicaid, everything, TRICARE, private insurances, managed care plans, so that you will get more idea about it. So today we have covered like, okay, what are eligibility, what is eligibility and verification, what are the major roles of eligibility and verification, how it affects the HIPAA compliance, how it affects whether the provider is in network or out of network, what are the key steps that you need to take up, what are the key things that you have to note down while you are taking the eligibility. Also, we saw that okay, in availability, most of the people make this error of selecting the correct specialty
Correct.
type code over here.
Facilitated.
Okay. So always for a physician office is it directly select 98.
Mm-hmm.
मतलब आंख बंद करके ये सेलेक्ट करो, जैसे ही वो बोलेगा ना कि हमारा प्रोसेस का स्पेशलिटी ऑफिस विजिट है,
मतलब
98
केस
सेलेक्ट।
सर्विस एम्बुलेटरी 24 हो इमरजेंसी कुछ भी नहीं थी।
हाँ, तो बस अब एम्बुलेटरी 2013 तो देखो, ये है 13 एम्बुलेटरी सर्विस फैसिलिटी सेंटर। ठीक है, इस पे आराम से आंखें बंद करके सेलेक्ट करो। सो द
एम्बुलेटरी के
मोर
लिए
यू,
यही करना पड़ेगा ना।
हाँ, और इसके साथ ना देखो, नाइन इसके साथ 30 डाल के रखो, लाइक यू आर व्हेन यू आर सेलेक्टिंग इवन द स्पेशलिटी,
ओके।
enter 30 also. Sometimes if it does not gives up, start in the initially do with your specialty only, but
ओके।
sometimes when they do not give up the full details, then enter 30.
हाँ, yesterday I saw one case like yeah, my colleague has searched this that 98. Then his detail that patient detail was shown like tier 1, tier 2, tier 3. I was
Yes, yes.
confused which he was taking like in every tier 1 also there was
Always you have to select. See, okay, so now you guys know for which tire you have to always select. Did he told you?
he told me like something tier 2 they are working.
Yeah, everybody, every time, see in India, when you're working, or even in United States, when you're working for a physician office visit practitioner, always you have to select tier 2 only.
Okay.
Okay, always it is tier 2.
What is this
Hospitals are for
tier
tier
1,
1.
tier 2, tier 3?
Yes. So hospitals are for tier 1.
Okay. And physician for tier 2.
Yeah, all physicians practice, solo practitioners, all are tier 2.
And tier 3 for durable medical equipment.
No, no, they are also in tier 2 only. Tier 3 is about these pharmacy peoples.
Okay. Got it.
Now, see, this is, see, tires means a network plans. Now, see, always when you see that tire, see, initially what happens is tier 1 are the preferred or in-network providers who have the best and rate and lowest patient
Okay.
cost. But why we select tier 2 is as because all the professional physicians and everything, and most of the companies, they select tier 2 as because they have that co-pay deductible co-insurance, those comes in. टायर 1 में ये सब इन्फॉर्मेशन आता नहीं है, और
Okay.
टायर 3 हमेशा ही आउट ऑफ नेटवर्क प्रोवाइडर्स का होता है, तो वो तो लोग लेते ही नहीं है।
Okay.
ठीक है, तो कोई अगर ऐसा पूछे टायर 1 2 3 क्या है, तो बोलना टायर 2 में इन नेटवर्क प्रेफर्ड या इन नेटवर्क प्रोवाइडर्स होते हैं, टायर 2 में सेकेंडरी और लिमिटेड नेटवर्क प्रोवाइडर्स होते हैं और टायर 3 में आउट ऑफ नेटवर्क प्रोवाइडर्स होते हैं।
Okay. Okay.
ठीक है। Ankit, are you able to understood? Now I know you are in office.
Yeah, Ankit, no problem.
No. So Pritesh would enter. See, I'm going through slow as because see, we have a month, we have a course. Of course, I have yesterday also told to other people that whenever you have to reach out, you find anything new, you find while you are working, you find any of the issues, ping me in the group. Either Pritesh is available or I am available. I will assist you out that okay, what is this new term that you have came across of whatever it is. Like okay, yesterday I was like you came across tier one, tier two. If the same time if you have mentioned us in the group, I would have told you at that time only.
एक्चुअली हाँ करने वाला था बट मैं सोचा आज जाके पूछ लूंगा वैसे भी मैं भी काम तो नहीं कर रहा हूँ बड़ी बढ़िया प्लेस में
हाँ हाँ कोई नहीं. So whenever you have any issues while you are
हाँ
working, okay, why if your team leads ask you anything and you do not
ओके
know, just tell that okay, I'll get back to you and we will or drop a message at same time and I'll get back to you on that. Now see,
हाँ
most of the peoples what they do is either they would do chat GPT AI and all, but that answer is then again you will get complexized on that only is because बता तो दिया चैट जीपीटी से अब लेकिन उसका डेप बेसिक तो पता नहीं है. Now if someone asks from that, then what would you do? So
हाँ
we clears your basics that okay, these are the basic, and once the basic answer is done, so next question won't come out. So this is very necessary. That is the reason see we are focusing more on clearing your basics. That is the
अच्छा
reason we are going.
okay
Yes,
okay
tell me.
on this point I will ask one more question.
Yes.
I need to know about that. What is this units about? You know, whenever the patient visits, so one unit gets over. So 12 units are there now for every patient for a specialty visit. That's my question.
For which billing?
For specialist visit, every patient got 12 visits, not 12 visits or 12 visits. 12 units, sorry, 12 units or 10 units. I need to know
No.
about the units. Means, in referral, my colleague was checking like how many appointment was completed. So he was calculating like that. Means two units got over. Then remaining there are 10 units. What is it?
No. No. See. See what happens is what your colleague was doing is he was verifying that okay how many units visits has been done.
Uh-huh.
Okay. So that he was verifying. It's not that only 12 visits are allowed. See,
Okay.
visits are allowed that comes into the insurance. So this is the different thing when insurance deny as maximum number of visits has been done.
Okay.
Okay, then people ask that okay, how many visits are in the year? Now it
Okay.
depends whether it can be 20, 13, 5, 6. It depends on the procedure or the service. So it's
Okay.
not necessary that only 12 visits are there for specialist visit.
Okay.
Okay.
Okay. तो ये यूनिट कैसे लेना देना नहीं ना मतलब वो भी
नहीं यूनिट का लेना देना नहीं.
ये यूनिट्स
वो
मतलब होता क्या है मतलब ये
यूनिट्स मतलब ये होता है कि देखो लाइक एक जो सर्विस करवाई है
हम्म
ठीक है यू हैव टेकन एन इंजेक्शन ओके
हम्म
सो यू हैव टेकन दैट वन टाइम और 2 इंजेक्शंस 3 इंजेक्शंस कितने लिए तो वो है यूनिट.
अच्छा वो
ओके एक
सीबीडी
बार
पे
लिया
डिपेंड
2
करता
बार
है ना
लिया
एक
3
बार
बार
हाँ
लिया.
ओके
हाँ
ओके
ठीक है
ओके
दैट इज यूनिट्स एंड विजिट्स इज डिफरेंट कि कितनी बार गया वो एक बार
कितनी
गया
बार
2
गया
बार
हाँ
गया.
वो डिफरेंट
ठीक
होता
है
है
this is the difference. Units is how many times you have taken that service. One
ओके
time, 2 time. Let's suppose the oxygen marks are also given. So 10 or sometimes you will see that 10 units of oxygen mask authorization has to be taken. So why?
ओके
Because patient has taken 10 new oxygen masks.
ओके
Okay. So that is the difference between unit and visit.
ठीक है अंकल आई नो माय क्वेश्चन वाज सिली
No. See, this is I'll see. This is how you will learn more, right? भाई पूछोगे नहीं कोई भी सिली क्वेश्चन तो सीखो कैसे. हमने भी तो कितना पूछा हो.
ठीक है अंकल थैंक यू एंड अंकित क्या हम पोर्टल क्रिएशन सीखने वाले क्या सेशन
हाँ सीखने वाले हैं.
ओके दैट्स
पोर्टल
ग्रेट
क्रिएशन सीखेंगे पर अभी पहले ये थ्योरी पार्ट
हाँ
कंप्लीट
चलेगा
करते हैं ना.
चलेगा चलेगा
है ना.
चलेगा
ओके
ठीक
चलो
है
देन.
हाँ थैंक यू सो मच फॉर टाइम
थैंक यू एवरीवन. चलो.